This is Valerie Briggs, Communications Director for RESNET, and we are so glad to have you join us today. Thank you for joining us for our webinar on RESNET's health and insurance access for the HERS network. As usual, today's webinar will be recorded and made available to listen to after. So if you want to rehear anything or share with some of your colleagues, there'll be a link available for that. We're going to do the questions at the end, as we typically do. So please use the question feature on GoToWebinar to enter your questions so that when we have our Q&A session after our presentation, we can try to get to as many questions as possible. Many of you are here today because, as you know, with insurance costs expected to rise exponentially in 2026, RESNET recently announced new health and insurance access for providers, raters, modelers, RFIs, rating companies, QADs, and training instructors via a partnership with American Affinity Alliance. So we are pleased to have with us today Chris Barnes and Chad Thompson from American Affinity Alliance to give us a preview of some of the services available and to answer some of your initial questions. So with that, I'm going to kick it to you, Chad, to get us started.
Thank you so much. Can you hear me?
Yes, we hear you great.
Very good. And can you see my screen?
Yes.
Okay, very good. So yeah, my name is Chad Thompson, owner of Thompson Benefits and Enrollment Group. We actually, Chris and I established, we've manage the American Affinity Alliance web page, and essentially what this is it's for convenience and support for individuals to help them access or help them shop and navigate the complex world of health insurance. So and then as a lot of you know, with the expected rate increases for 2026, and we still kind of don't know what's going on with the subsidies. Obviously right now might be a time that some people are a little more stressed or concerned than normal with their health insurance options. And so what we've got here, and I'll kind of show you just an overview of the website, and then I'll talk a little bit about a couple of the health plans here. But really, again, this website is really just a convenience. It's a kind of a one-stop place where you can go just to look at a couple of different options. So we actually have an enrollment team. Our enrollment arm is called United Benefits, and they actually have a team that is licensed in all 50 states that are certified in the ACA marketplace in all states, also Medicare, and they also have some other off exchange types of plans, such as United Healthcare, and also some that use the Cigna PPO network. So really it's a matter of, most people just like to shoot us an email, or which is several you already have, which has been great. Pick up the phone, call the team, or shoot us an email, and we'll basically kind of help navigate that. So because when it comes to the ACA marketplace, a lot of people don't know what exactly the marketplace is. Or why they might want to shop there, right? So, or what are subsidies, or do I qualify for subsidies, or is that the best option compared to some other options? So, yeah, that's kind of something that our team helps you kind of navigate. And so, but so really the website here, really, like you said, if you can see this here, it's you can speak to a live agent. This is a little click button. If you're on the mobile version, you can just click this and it'll call the team directly. Again, they help with the ACA marketplace plans, Medicare, and also off exchange plans. So we've got the health plans for individuals and families. So again, ACA marketplace, Medicare. There's also a major medical plan that uses the Cigna PPO network, and it's through a plan sponsor, a plan employer group called 1099 Workers LLC. So this is actually an opportunity for those that want to gain access to a large employer plan that might be a better fit than some other plans you could find on the market. So you can actually do that. So you can actually enroll through this link here, or you can call. They will help you with that. Um, but it has a national network, um, and um, and it's in 40, I think currently 47 states. Um, but um, but yeah, again, that's another option that this team here will go into with you. You basically onboard as a part-time or PRN W-2, and essentially you become an eligible employee of that organization to access that group health plan. But of course, there's more details that they'll go into as well on the phone, or through. You've got the link here as well. Take you directly to the landing page for you to view the rates um, and things like that. So then right down here is the supplemental, ancillary benefits, and more. So this are things that are not major medical. These are things that you can, things like dental and vision, uh, Medicare supplements, short-term medical, dental and vision, travel insurance, and pet insurance. So essentially, you can click one of these items here, and it will take you to a separate landing page where you can kind of view different rates and availability by state and things like that. And then the Medicare support team is, again, that's the same team that this is a Medicare supplement. It's the same team that does the Medicare as well, and so they will help you shop based off your state. When you call them, you tell them what you're interested in and what state you're calling from, what your resident state is actually, what state you live in, and they will send you to a specific agent that is licensed in your state and familiar with your available plans as well. So and then down here, health plans for businesses and employees. So we do also have some additional plans for small businesses. We've got some plans that will currently go down to just needing 2 employees enrolled. And as long as you don't have more than 50 full-time employees, there's no employer contribution currently required. But again, that's just kind of one of our basic plans that a lot of people like. It's affordable, doesn't have any deductibles on most of the plans, and so but sometimes we talk with employer groups that have 5 or 6 or 7 employees, and they want to shop, go through the full shopping process, and shop out different options, and we can help with that as well. So sorry, I try to keep it a real brief overview of the website and how it functions. And then, did you want me to kind of touch on anything else specifically on any other specifics there? And regarding the ACA marketplace, that's one thing that, when you call the team, as you know, the ACA pricing or subsidy eligibility, things like that, those are going to be based off your state, your age. Also, the subsidies are the aka tax credits are provided by the government. Those are going to be dictated based off your current household income, and how many people you have in your household. And so again, that's something, you just pick up the phone, talk to the team, say, look, this is what I'm looking for, and they can help you with that as well. So but with that being said, was there any other maybe specifics we wanted to kind of touch on? I know I was trying to keep it kind of high level and brief and allow plenty of time for questions and things like that.
Sure. Could you talk maybe a little bit about the sort of the open enrollment period? I know there'll be people who are wondering when that changes or how that factors in.
Yeah, great question. So with the ACA marketplace, that is the 15th. Chris, correct me if I'm wrong, but I believe it's December 15th is the cutoff for a January 1st effective date. And then you can actually enroll up to January 15th to get a February 1st effective date. And then on these major medical plans here, they actually follow suit with the cutoff for December 15th. But the ACA Marketplace has an annual open enrollment. And so they will have they have an annual open enrollment. And if you don't enroll during that open enrollment time, if you want to, get on the marketplace plan, you'll need to have a qualifying life event. So like a change of address, a marriage, those kind of things, a loss of coverage. But so that would be required to be able to get on an ACA marketplace plan outside of this open enrollment period. But these plans here with the Cigna network through the 1099 Workers LLC, those are actually open year round. They're basically effective first of the month following 30 days, is what that currently is set at. But you can enroll technically in the middle of July if you wanted to without a qualifying life event.
Okay. And to confirm, you're offering both individual plans, so for our individual raters, RFIs and such, and then also possibly employer-related plans, say for the rating companies and the providers who employ multiple people. That's correct, right?
Yes. So there are plans available for just individuals and families. They could shop these major medical plans, the 1099 workers, as well as the ACA marketplace. And then yes, we do have some other options for employer groups as well.
Do you have any kind of grouping of companies, like on a statewide basis, to have a larger group to reduce cost?
Sorry, say that again.
Do you ever do any sort of grouping? Like if there were a number of different companies in a state wanting to come together and work with you to have maybe a plan that then had some, I guess, economies of scale to make it cheaper. Do you ever do anything like that?
No, unfortunately, I think regulations consider that to be like a MEWA, and those are pretty highly regulated. So we can't do like anything like that.
Kind of like a wholesale distribution kind of group. You can't do anything like
Right.
that.
Right.
Okay. Do you have plans for companies that are over 50 employees?
We do. Yeah, we do. Yeah, we can shop those out with national carriers like United Healthcare and some other options as well.
Okay. Just a reminder to our attendees, if you have questions, feel free to drop those into the question box. Chris or Chad, are there sort of frequently asked questions that usually you get when you sort of start out with a new group like this?
I'm trying to think, Chris, yeah, go ahead.
Yeah. So a lot of employers will ask, well, how much do I have to contribute in order to implement this plan? So we have programs that require no contribution in order for them to establish a group plan, which that's a rarity because most of the traditional carriers, they'll want you to implement at least 50% of the employee only coverage. But in these situations with our programs, you wouldn't need to do that majority of the time. So
Okay.
there is access for that.
Okay.
Yeah, and that was so he was referencing specifically the employee groups for the under 50. And the reason why we mentioned under 50 is because if they are 50 or more full-time equivalents, then that's of course the Department of Labor requires them to offer ACA compatible health plans. So and contribute have to be quote unquote affordable, and there's a little more complexities into it than that. So yeah. So but as far as frequently asked questions just in general for like new association members and things like that, really that's the number one question we have is people just get on the website, which is again this is why this webinar is great, is because a lot of times people might just get on the website and they'll see a few different options here and they'll say, well, where do I need to go if I have some questions, right? Or where do I need to go to find information on the health insurance or health options? And so that's honestly, we just, for simplicity, we tell people you just call that number or you can email us. and we'll get you directly to the supervisor team at United Benefits, and they can kind of really take you from A to Z, because again, I understand health insurance is confusing for most people. So while this website is designed to provide some basic information about what's available and what the support team can do, typically what the best option is just to from point A, just pick up the phone or email us, and then we'll say, hey, what state do you live in? What's your household income? Let's see what you can qualify for on the marketplace, or we can look at some other options as well. Kind of walk that member through that process from A to Z.
Sure. Let's see, do you have to be a 1099 worker in order to utilize the 1099 plans?
No, that's a good question. It was actually designed years ago for 1099 workers, and that's why they named it that. But no, you can be a 1099 or you can be a W-2, and as long as you're 18 and actively working and a resident of the U.S., then you can actually join that group.
Okay. Great. Can spouses or dependents utilize a possibly less expensive option if the employee stays with our company plans?
Say that one more time.
Can spouses or dependents utilize a possibly less expensive option if the employee stays with the company plan that you help them develop?
Well, I mean, possibly, yeah. I mean,
Yeah.
really, the rates for these groups are, depend. It really heavily depends on, you've got state availability, you've got the size, how many employees are enrolling, what the health of the group is. So really, every group might be a little different on their pricing, but that's another benefit of us being able to help people look at the options for individuals as well. Because sometimes if you have a really small group, then maybe it's not beneficial to have a group plan. Maybe it's actually beneficial to be on a marketplace plan.
Okay.
Yeah.
So the links on the site require you to call an agent. Is there any sort of page where you can get just sort of actual quotes and comparisons for the different programs?
Well, so you can click on the Cigna, this major medical for the 1099 workers, and go directly to their link here, and you put in the basic information, and you can pull up your quote that way. Yes, absolutely. So you can pull up your current rates. The rates listed on here are semi-monthly, and I believe there's currently 5 plan options. But when it comes to ACA Marketplace, and the other options they've got, there's really not because there's so many options, and it's going to be dictated specifically on, again, your state. The different states are going to have different plans available, different pricing available, and then of course it's going to be based off the person's specific age, and all those kind of things. So there's really nothing like a blanket summary that we could provide for the ACA or the other plans for individuals. So it's really kind of a shopping experience through the United Benefits will kind of go into their portals, put in the members' information and help them shop, and then send them the quotes from there.
Okay. What happens if someone is unemployed or between jobs?
Well, that's a good question. So we do have, so that's where like your ACA plans are good. You could do an ACA plan potentially within that qualifying life event window. And then also there in many states, there's also what's called short-term medical. For example, United Healthcare is a big provider of short-term medical plans, which are specifically designed to kind of help bridge that gap while employees might be in between jobs.
Okay. We do have a question about if someone is qualified for an advanced premium tax credit and they sign up through applying for a policy through you all, will that tax credit be applied or would they have to pay the full rate?
So good question. So those are going to be two different types of things. So ACA marketplace, that tax credit and that platform, the ACA marketplace, that's exactly what this team will help you do on the on exchange plans, right? That's where those tax credits are provided, right? So that it's specifically through the ACA marketplace, where on the off exchange plans like this one here through the 1099 workers, that's like a different plan, sponsored plan. That's not through the ACA marketplace, so you couldn't use any type of tax credit towards that.
Do you have sort of an average employer subsidy dollar amount given to employees that you work with?
No. Again, that says the subsidies, again, those are on an individual basis. Those are, have nothing to do with employers or employees. Those are just for individuals, and those are going to be very based off state, again, and their household income, household how many people live in their household. Because if somebody depends on somebody's really their income and how many people live in their household is what it's going to come down to, on how much subsidy dollars are available for that person.
Okay. Someone's asking, does United Benefits only work with select insurance plans, for example, United Healthcare or Cigna?
No, they've got access to several. I think another one is Allstate, right, Chris? They've got access at Allstate.
Yes, sir.
Is it
National General.
Yeah. Okay. Yeah, one of them bought the other one out recently. I can't remember. But yeah, so there are other options as well. And then of course through the ACA marketplace, there's typically a handful of different carriers on the marketplace as well. And those are going to be different in different states.
Okay. Great. Reminder, if you have any more questions, please enter those into the question box. I'll just ask one in the interim while we're waiting for other questions. Can you talk a bit about the pet insurance options? I'm just curious for myself, being a pet owner.
Yeah. So let's see if this will pop up here. Yeah, they've got their new website here. So this one's starting at $19 a month. It's got a little video you can watch here about the options. You get the really, again, this is kind of like a self-quoting platform here.
Sure.
Let me see here. PenPals Plus, and the insurance piece of it is actually provided by MetLife on the back end, but cloud.
Great. I was just curious for myself. In addition to obviously the healthcare options are very important, but I saw you had pet care on there as well.
Mm-hmm. They've even got pet telehealth and discount pet meds and supplies, and and really there's 4 different types of like levels you could purchase.
Okay.
So yeah, PenPals Plus, PenPals Pet Care, PenPals, and the care plans. So each one of them is a little different on all the things that they cover as well. But
no, that's great. Thank you. That was a selfish question on my part. We'll go back to the questions asked from the field. Let's see. So I think we're trying to get a little clarification on some of one of the last questions we have. Do the employers that you work with give their employees an average contribution amount for each employee to purchase a plan? And if so, what's that average amount?
That's a really good question. So if they're if assuming they're under 50 full-time equivalents and there's not a requirement of how much, I will say that, Chris, correct me if I'm wrong, we really see a lot of employers, because typically small employers are trying to keep an eye on their bottom line and their expenses. They want to offer some type of health plan for their employees, but they also have to stay in business. So what we typically see is, I'd say, between the $200 a month and $300 a month per employee. Yeah, Chris, would you say that's about right?
I think that's a fair, number.
Yeah, and a lot of employers could say, hey, we're going to cover 50% of of your employee only cost, right? If they want to add a spouse or dependents, they can do that. But of course, that would be on the expense of the employees. But some employers, instead of doing a percentage, they'll just do a flat dollar amount based off what they feel comfortable with as well.
Have you seen employers just offering health insurance stipends to employees to offset self-funded insurance plans instead of offering health insurance?
Yes. Yeah, that's a pretty common thing. Sometimes employers don't want to go through the process of setting up a program.
Mhm.
And so yes, that's a pretty popular thing as well, where they'll just say, hey, tell the employees to go shop, and then we'll add X number of dollars to their paycheck, or set up a stipend.
Great. So someone asked if there are a single member LLC. So does this plan cover the professional only, or also there are family plans as well? Could you confirm that again for us?
Yeah, it would cover the family as well.
Okay. Okay, great.
So yeah, now some of the group plans would require at least two people and two different employees from different households to be enrolled to establish a group plan. But there's several of these plans. For example, the plan through 1099 Workers LLC, for a single member sole proprietor, like that's a great plan for a sole proprietor. But again, I encourage you to also shop options. It's a good health plan, national network, but maybe you could find a good plan on the marketplace as well, or maybe one of these other alternative health plans through like United Healthcare might be a good fit as well. So yeah, it's definitely worth shopping.
Sure. Are there pros and cons for employers offering the stipend versus offering a group plan for employers over 50 FTEs, for instance?
Well, they if they're over 50, they have to offer a group health plan.
Okay.
Yeah, so they do have to offer the like ACA compatible. It has to be affordable, right? That's like a Department of Labor requirement. But if it's under 50, they don't have those requirements currently. And are there pros and cons? Really, it just kind of comes down to what your goal is. A lot of times, employers, we see that they're really trying to provide something valuable to their employees, to help retain them as well. And sometimes those group plans, hey, you're part of our group. Sometimes those are a little more attractive than just a stipend, right? But if you can't get a good rate, right, then it's going to cost you a whole lot, or cost the employees a whole lot. Then maybe the stipend's a better route.
Sure. Okay. And again, to clarify, these benefits are, now being offered in partnership with American Affinity Alliance for raters, RFIs, modelers, QEDs, training instructors, and again, rating companies and rating providers as employers as well. So you're eligible for that when you are in one of those statuses. All right. If there are any other questions from attendees, please enter them into our little question box here. I think we might have been, let's see. So we have another couple coming in. Stipends are taxed by 30%. That's the question. Do employers require you to provide health insurance documentation before offering the stipend? As an employee, are you required to, sorry, I got to read the rest of the question. Are you required to give this documentation to the employer before the stipend is applied?
I'm going to have to defer to their tax credit, or to their accountant on that one.
All right.
Yeah, because
Okay.
every business is set up differently, so we don't want to advise inaccurately on that.
Sure.
If we knew the employer, we were sitting down with them and we kind of understood their business, and then are they an S corp, are they an LLC? We would be able to help kind of navigate that. But it'd be very hard for us to kind of just say yes or no to that without knowing those details.
Sure. Do the group plans typically have lower rates than the marketplace plans?
That is a good question. It is that really will vary based off the state. I know I keep saying that, but it's so but the size of the group, if we should, depends on what group plan they're looking at as well. We've got some that are around $530 a month with no deductible. And then we've got some that we would shop, right? We'd send in like a health questionnaire for each employee. We'll send it off to like a company like Allstate and United Healthcare, and we'll get the quotes back from the carrier. And those rates are going to be very, very different based off the size of the group and the health of the group. And then also each state, when it comes to comparing it to an ACA marketplace plan, because those are all individual plans, but it's through their respective state. Those are so different as well. Honestly, you could look at one state. It could be I mean, $200 more expensive in a certain state than another state. So it's really kind of comparing apples to oranges.
Right. And you're saying again that, sorry, go ahead.
Yeah, but that again, that's why we encourage people to just call and talk with the experts at United Benefits and say, hey, let's, here's some information about me and what we're looking for, and then they can kind of help navigate what their options are from there.
Right. It sounds like it's very individualized depending on a lot of different factors.
Yeah.
And to clarify once more, you saying that if the employer has over 50 full-time employees, they cannot offer a stipend to employees, but rather they need to shop through the marketplace or a private insurance plan. Is that correct?
Well, I don't believe they can do a stipend. I know there's certain types of like HRAs and ICRAs and things like that, I believe would satisfy that requirement. But typically they are required to offer some type of group plan. That would be different than like the ACA marketplace plans. But again, we do our wheelhouse is primarily small, your small employers and individuals. And so, when it comes to the larger groups, we typically bring in our like compliance team to say, hey, what can you do? What can we not do? And another thing, different states have different rules, right?
Sure.
How an employer can contribute to a health plan and those kind of things.
Right. And for the company plans, it could be available to all the staff of, say, a rating company, not just those who are serving as raters or rating field inspectors, correct? Say like an admin person in the office.
Oh, yes.
Wonderful. Okay. Let's see if any more questions are coming in. It sounds like we've covered some of the ones a couple different ways. Is there any sort of last minute thoughts you would like to share, Chad and Chris, with folks? We're going to give them the opportunity also to, I'll ask people if they want to have someone contact them directly or anything, if they are definitely interested in pursuing more information. But is there any closing thoughts you might want to share with the folks while they're on the line?
Yeah, really. I'm honest with you. I think just reaching out, calling the team, and then emailing us. If you're interested, if you got questions or you're interested in shopping, help and us helping you shop, the individuals, as an individual, we can do that. And also we can, take a look at talk to you about your employees, and help you find a plan as well. Now, again, a couple of these plans, I mean, for, some of the plans here that you could access outside of ResNet on, right? So some of them, but it's kind of like an ACA marketplace. Technically, anybody can get on the ACA marketplace outside of ResNet, but what we're doing
Sure.
as a benefit is kind of bringing it all to like a one-stop shop to really help simplify that member experience, and that is hugely valuable because there's so many people that waste so much money and spend way too much on their health care or their health insurance simply because they don't know there's other options available or maybe tax credits available. And so that's really what we're trying to help mitigate and really try to help members through that experience. And and right now with such crazy times in the health insurance market,
Right.
I really feel like that is a huge benefit, to be able to pick up the phone and talk to somebody and say, hey, can you tell me, I just got this letter in the mail telling me my premiums are going to go up, or can you help me understand this, or can you help me look for other options? And so that's really what we're here to do.
Excellent. Great. Well, I'm sure you'll probably get a lot of some things on the website and questions after today's webinar. We certainly appreciate your time, Chris and Chad, joining us today. And what we'll do, as we mentioned before, is we're going to send out the video, the audio recording, and any other information we can share with those who have attended and registered for today's webinar. We'll let you know more about the eligibility requirements in terms of being part of the ResNet network. And we look forward to kind of maybe having some quarterly calls, at least with you all, to kind of get an update on what folks need to know as they plan out their insurance packages for themselves and their employees.
Absolutely.
Wonderful. Thank you so much for your time, everyone. And we look forward to seeing you again on the next webinar. Have a great day, everyone.
Appreciate you all. Thank you.
Thank you. Have a great day.